Good morning, everyone. I'm Metrodora Clifford, and I'm going to try and give you a good understanding of the differences between nanosecond lasers and picosecond lasers in the Q-switch range. So is the market ready for this? A very quick short story about me. You would have heard from Tina. But we were the first ones to introduce the Q-switch lasers, epidermal growth factors, stem cells, various enzyme peels, copper peptide, and of course our first microdermabrasion. The only other thing I could say apart from my credentials is that I have now offering a graduate certificate in cosmetic lasers and dermal therapy, and if there is anybody there that is a dermal therapist but do not have the paperwork to say you are a dermal therapist, please come and see us. So what is today's challenge? Besides, despite the advent of laser technology, nanomolecular science, and dermaceutical medicine, treatment of multi-pigment disorders remain a great challenge to both cosmetic physicians and dermal clinicians. So in subsequent slides, I will show you how recalcitrant melasma and hyperpigmentation disorders in different skin types is no more the challenge it used to be with a picosecond laser. Very quickly, I want to give you an understanding of the melanocyte forming unit. If you go below the basal layer into the dermis, pigment starts to be formed there, and that then becomes a difficult melasma to remove. But most of the melasma, we know, generally forms in the epidermis, and this can be easily removed if you use the right method. So why are nanosecond lasers not able to remove it? First of all, most of the melasma has got blood pigment in it, and although nanosecond lasers are attracted to the blood, the 532 particularly, even the 1064 in darker skin types, you will find that the dermal hemorrhaging occurs, and this is not good, especially for Asian skins, because their skins are very thin, although it is highly nourished with needs more moisture. If you're going to use a nanosecond laser for pigmentation, it is a good idea, therefore, for you to do it slowly, with less energy, and allow at least a year to remove it. So the epidermal melasma is what you will see when you look through the under a wood's lamp, and you can see the pigment. It's mainly under the surface of the skin. So how do we manage pigmentation? Theoretically, destroying the overproduction of melanosomes in the melanocyte that forms the pigment blocks in some areas will be one way to go. Secondly, to inhibit these melanocytes using tyrosine inhibitors immediately pre and post laser treatments will be helpful. Alternatively, if they're young, they're just starting, a carbon peel will also remove it because it's attracted to it removes the keratinocytes, and the carbon peel will remove the keratinocytes, so it gives you a nice even glow. Other than that, so nanosecond lasers sometimes fail. Why? Now, because of the theory of biostimulation, laser is a form of light that possibly triggers melanocyte synthesis. We know that. Secondly, most of the lasers have thermal energy, and it creates injury to the skin, and that inflammatory process activates melanin production. So cooling the skin is very, very important during a treatment. Thirdly is the depth of penetration of Q-switch lasers. Because they cannot penetrate to all the depth, a hormonal pigment will resurface just when you think you've got it all. So if you are going to use a nanosecond laser and cannot afford a pico still, try and find one that has a PTP mode, a pulse-to-pulse mode. What this simply means is that it breaks that one pulse into two and it allows the heat to dissipate, so you will get far more better and quicker results. Secondly, you can use MLA Handpiece. Now here is a solar lentiges using a nanosecond laser. This is after 5 treatments. You're still doing it gently, and you can see that it will take some more time to go. There's still some residue of it. This is Hori's treated with a nanosecond laser. You cannot remove it completely. It will resurface because the Hori's is something that's in the dermis, and so it will resurface. Auto. So these are different types of deeper pigmentation, which you can reduce, but you cannot remove it. It's attracted to the blood pigment. So as you can see, it removes the pigment on the surface, and what you see there is the blood pigment. So as soon as you are able to destroy the blood pigment gently without causing any hemorrhaging, you would start to get some results. So the conclusion on nanosecond lasers are that hyperpigmentation can be lightened up to 90% with 10 to 12 visits using a Q-switch pulse-to-pulse mode with the genesis, and so that you produce no inflammation. And you can use an MLA handpiece if you're treating melasma, or you can do a combination therapy where you use microneedling, not more than 0.25. You should not bleed it if you're doing it for pigmentation purposes, and use a melasma essence along with it. And then you can also use the LED to reduce inflammation. So this is what I would recommend if you're using a nanosecond laser. However, it's not possible to achieve permanent or lasting results with a nanosecond laser. And why? Sometimes you can get pigmentation treatments will not work. Some will work on some of the time, especially if it's just started, more frequently on some and not at all on others. So what are your choices? I'd like to introduce to you the Pico High, which is a true 300 picosecond laser. So in explaining why, the Pico lasers deliver a high rate of irradiation to treat pigmentation within a very short period. Example, a laser beam is 1,000 times faster with a picosecond laser compared to a nanosecond laser, and we can get the same desired result all the time. Unit of 1 pico is 1 trillionth of a second. So a new Q-switch technology brings about quicker and consistent results all the time. Second reason, this speed of the laser is so short and so fast that on the right you will see it does not destroy this. It minimizes skin tissue damage around the treatment area. It is also fast because it uses photomechanical effect rather than photothermal effect. And so the second reason will be the PIH, the stress relaxation time of a melanosome, which is normally 1 micron, is about 333 picosecond. So if you're giving it a acoustic shock, which is confined only to the melanosome, you can destroy the melanin in them. And it produces no side effects, no inflammation, and as well as the picosecond lasers implements a very stable. This is the Pico High, very stable, 300 picosecond, more precise laser irradiation rate, irrespective of what spot size or energy or speed you use. This minimizes the damage that you can normally see in a nanosecond laser. And finally, because Pico high lasers has the shortest pulse duration, it can produce maximum energy output of 1.67 gigawatts, and therefore has a lot more advantages. So what is the difference between when you try to break the pigment? In the nanosecond laser, you can see the pigment is still quite large, and it ends up in the lymph because they are too large to be removed. But in the picosecond lasers, you can see it can produce a dust, and at the same time, it does not remove, it does not injure the tissue around it. This is what a nanosecond laser, and what a picosecond laser into fine particles. So let's have a look at pigment. So this is how it will reduce pigment in the skin, and that gets taken off by the macro fibers. So looking at this, you can see this is an example of a picosecond laser removing on a piece of paper. You can see it doesn't burn, doesn't leave any mark. It completely removes just the ink or just the pigment, so you can see how carefully you can remove it without injuring any other tissue in the skin. And this is why we say that this is the market is now looking for something like this, because you don't want to produce another problem. Now, the Pico High 300 features 300 picosecond pulse duration, much shorter than other picosecond lasers, which are 450 or 750, which is closer to a nanosecond. So this gives you a photomechanical effect, and of course without damaging surrounding tissues. You can use a picosecond laser also for acne scarring, tattoo removal, skin rejuve, melasma, actinic pigmentation, photo damage, stretch marks, large pores, all kinds of tattoos, cosmetic as well as all colors, and lines and wrinkles. Now, this is a cosmetic tattoo. This is one treatment, as you can see left and right, and you can see small lentiges removed, scar tissue. This is all just one treatment of these, and you can see how much better these look. This is a picture of someone with a large pore, and you can see that even after one treatment, his pores are reduced. Again, Asians have this problem with the large pores, so it's only the picosecond laser. There's nothing else in the market that will do this treatment as effectively as this. Again, she's only starting to get mild pigmentation, just freckles. So the picosecond with the toning is great on this. Again, a melasma, it's left and right. You will have it on the same spots. 3 treatments, you can see how it's reduced. And other treatments that can be treated are freckles, melasma, a cafe au lait, nevus of Otto, age spots. You can see even it brightens and lightens the skin, even on the hands, and it can remove all the different colored tattoos as well as stretch marks, apart from open pores, acne scars, whether the scar is a box scar, icepick scar, rolling scar, hypertrophic scar. All this is a form of skin rejuvenation. Other treatments, you can see the blue-green color. Tattoo is generally very difficult to remove, and you can see it's been removed. Also, pigmentation and acne. These are very obviously 1 to 3 treatments only. The other thing that the Pico High can do very well, bubbles within the dermis, and this helps with rejuvenating the skin, causing new collagen using our MLA or our dough handpieces, and this gives the ability to revitalize the skin as well. LIOB is laser-induced optical breakage, and it creates a pigment removal, whether it's in the epidermis or the dermis. If you use epidermal, if you want to treat pigment in the epidermis, that's how you would start with, and you would use the MLA handpiece, which will create both in the epidermis as well as the dermis. You can. There is a video coming that will show you all this. And at the dough handpiece applies even energy in the same spot, whereas you can treat each wherever the pigment is, whether it is in the surface, middle, or in the dermis. Using your MLA handpiece, you can decide to go larger depending on the scar tissue. It is very similar to your CO2 lasers, which has the downtime of 1 week. However, using the Picosecond laser with these MLA handpiece, which is a fractionated handpiece, will give you excellent results and appearance of pigmentation for melasma without damaging your collagen. There are some great clinical studies on our website that will speak about the different studies that have been taken and how the different handpieces, you can get 6 to 7 handpieces with our Pico High system. I know it has entered the market a little bit late, but we've done our research and it will produce excellent results, better results, and with better features as well. So one of the features is the remote management through the cloud system, so you don't have to pay extra for your for managing your maintenance. It's all done by the manufacturer in the directly from the manufacturer's factory. It also will give you a little bit of time when you need to change your light, lamps, those sort of things. The program, the configuration, patient-specific protocols, these are all added to it, so even a new person using a machine can straight away use it, because all the malfunction prevention is done with a different color guide. If you're doing 1064, it's blue, and it's another color green for 532, so you will not misuse the wrong handpiece for it. So most of the clinic have smaller rooms, and with such big machines, we have a tabletop to conveniently put things on the for you to change your handpieces. There is a compartment to store your handpieces, so it's not all jumbled up together. You have a shark vent hole. All of these are very well designed, and so we like to tell you that the market is now ready for a picosecond laser. A lot of multi-pigmentary disorders today we feel in the market are now ready to accept this high cost of treatment, as the results are good, quick, clients don't mind paying the high investment costs it carries, and if they want to get even good-looking skin in a shorter time. So the high convenience and shorter pulse duration, stable output, many spot sizes, better clinical evidences, all of these make the Pico High 300 the best choice available in the market today. In conclusion, I'd like to say, to treat melasma, the Pico High, which otherwise can be, you can only maintain it with a nanosecond laser. So if you know that, you can tell your client beforehand. Highly reputable investment, can treat all tattoos, all skin types. Every skin that comes through your doors can be treated, and multi-pigmentary disorders without any risk of hypo or hyperpigmentation can be treated as well. As you can see, there are 7 different handpieces, and I'd like to show you a quick video that will enlighten you about how quick and fast this is about. Generation Pico system, and it uses photomechanical waves, so it doesn't produce any light, and you can see that the different handpieces, how quickly it breaks it into dust. It keeps up the stable, reliable, irrespective of the speed, continually produces the yellow can be removed very, very easily with this. As you can see, all the colors in the rainbow, your basic handpiece will be able to remove this, and you can see we change it to do the greens with we have 4 different wavelengths as well in this system. So you can choose your wavelength, 4 different wavelengths, and the pulverizing of the pigment is really great. So black tattoos can be removed in 1 to 3 sessions, If it's cosmetic tattoos, you only need one session because most of the cosmetic tattoos are done on the surface of the skin. And when you're removing pigment, it removes it the same way. You can use the columnated handpiece, which doesn't matter how doctors like to use it, sometimes without touching the skin, so it has the same depth and will remove the pigment irrespective of whether you use it on the skin or away from the skin. Facial lentigos, you can use the 532 zoom, and as you can see, you have all of these in the system, and at the touch of a button, it's very easy to get acclimatized with this machine. Maintenance is not a problem at all, blue or green. It depends on the wavelength that you choose, and this will help you. Each of the codes, by pressing on that, will give you an easy access or easy guide to remove them. So I would like to introduce the Pico High 300 as the most latest technology on the market today. Thank you so much for listening to me.